Sarah Taylor had never considered herself particularly remarkable. As a paramedic with 15 years of field experience on Earth, she had developed a straightforward philosophy about emergency medicine. Practical solutions worked, and sometimes the simplest approach was the most effective. This philosophy had served her well throughout her career, from urban trauma centers to disaster zones following earthquakes and floods. She prided herself on her ability to stabilize patients with minimal resources, often working with nothing more than the contents of her medical kit in her own two hands. So when the opportunity arose to participate in an interspecies cultural exchange program aboard the Xylar research vessel Stellaris, Sarah had volunteered immediately. It wasn't just about the adventure of space travel or the chance to be among the first humans to work alongside the crystalline Xylarians. Her practical nature saw it as an opportunity to share human medical techniques with a species known for their technological sophistication, and perhaps to learn a thing or two herself. What she hadn't expected was quite how vast the philosophical gulf would be between human and Xylar medical practices. The Xylarians were a sight to behold, tall, slender beings whose bodies contained complex crystalline structures visible beneath their translucent, bluish skin. They moved with deliberate grace, their long limbs flowing in motions that seemed almost choreographed. Their society valued precision, cleanliness, and technological advancement above all else, particularly in medicine. Sarah had been briefed that Xylar medical facilities utilized advanced biological scanning technology and non-invasive regenerative procedures that typically involved energy fields rather than physical instruments. Their physiology was, by human standards, remarkably fragile. A Xylarian's internal crystalline matrix could be disrupted by physical trauma that a human would consider minor. Their equivalent of a circulatory system contained a luminescent fluid that was highly susceptible to contamination. Even minor bacterial exposure could cause potentially catastrophic infections within their delicate systems. This physiological vulnerability had led to the development of their sophisticated, sterile medical approach. When Sarah first toured the medical bay aboard the Stellaris, she'd been impressed but somewhat overwhelmed. The chamber was spotlessly clean, with not a single visible joint or seam in its smooth, pearlescent walls. Floating holo interfaces hovered near examination platforms, displaying biological data in 3 dimensions. There were no visible surgical tools. Instead, articulated arms descended from the ceiling when needed, each tipped with what looked like finely focused emitters of various energies. This facility represents the pinnacle of Xylar medical science, explained Chief Medical Instructor Vorel, the tall, senior Xylarian assigned to oversee Sarah's integration into their medical training program. Vorel's crystalline features didn't display emotion in ways Sarah could easily interpret, but his tone carried unmistakable pride. Our medical interventions occur at the cellular level, eliminating the need for primitive cutting or suturing techniques. Sarah had bit her tongue at the primitive remark. She'd encountered similar attitudes from human surgeons with state-of-the-art operating theaters when they discovered she was just a paramedic. Instead, she smiled and nodded, watching as Vorel's slender fingers manipulated the holographic controls with practiced precision. The students were a mixed group, 8 Xylarians at various stages in their medical training. Among them, 2 stood out immediately to Sarah. LYX was slightly shorter than the others, with a more pronounced blue tint to her crystalline structure. Her questions during orientation had revealed an insatiable curiosity about human physiology and medical practices. By contrast, Zorn was the tallest of the group, with an almost perfectly geometric pattern to his internal crystals. He rarely spoke except to cite Xylar medical protocols and seemed deeply skeptical of Sarah's presence. Tomorrow, Vorel had announced at the end of Sarah's orientation, we will conduct a simulated emergency evacuation drill. This will provide Paramedic Taylor with an opportunity to observe our protocols for managing casualties in crisis situations. Sarah had nodded, secretly pleased at the chance to see Xylar emergency medicine in action. In her experience, emergency situations revealed the true character of medical practitioners more clearly than any controlled demonstration. She could never have predicted how that drill would unfold. The evacuation simulation began smoothly enough. Voral had programmed the ship's systems to simulate a minor hull breach in a research section, complete with warning klaxons and emergency lighting. The medical students responded with impressive efficiency, gathering their emergency kits, sleek, handheld devices rather than the bulky bags Sarah was accustomed to, and moving toward the designated emergency zone in perfect formation. The simulated emergency area had been dressed with scattered debris and flickering lights to represent damaged systems. Several holographic patients with various injuries awaited triage. Sarah observed from nearby, making mental notes on the differences between Xyler and human emergency protocols. What happened next occurred so quickly that Sarah would later have trouble recalling the exact sequence of events. One of the support struts used to create the simulation environment, a real, physical metal beam, became dislodged from its moorings. Perhaps it had been improperly secured, or perhaps the enthusiastic movements of the medical students had jostled it loose. Whatever the cause, the beam came crashing down with a resounding clang. Sarah's instincts kicked in immediately. She lunged forward, pushing LYX out of the beam's path. The Xylarian students stumbled to safety, but Sarah wasn't quite fast enough to completely clear the area herself. The edge of the falling beam caught her forearm, tearing through her uniform sleeve and into the flesh beneath. She staggered back, immediately clamping her other hand over the wound. Blood welled between her fingers, a clean, deep laceration approximately 3 inches long across her forearm. It was bleeding steadily, but not arterially. Sarah had seen and treated hundreds of similar injuries throughout her career. It needed cleaning and stitches, certainly, but it was far from life-threatening. The Xylarians, however, reacted as though she'd been mortally wounded. Biological integrity breach. Zorn cried out, his voice rising to a pitch Sarah hadn't thought possible from Xylarian. Class 7 contamination risk. Within seconds, Sarah found herself surrounded by the medical students, their scanning devices deployed and aimed at her arm. Above the devices, holographic displays bloomed with what looked like magnified images of her wound, alongside rapidly scrolling text in the Angular Xyler script. Massive cellular structural instability detected, one student announced, voice quavering. Microorganism infiltration imminent. Another added with clear alarm. Voral pushed through the circle of students, his own scanning device already activated. Prepare the emergency containment field, he ordered. We must stabilize the wound before systemic degradation begins. Before Sarah could protest, 2 students had deployed a floating gurney that hovered at waist height. For others gently but firmly guided her onto it. Wait, Sarah began. It's just a cut. I don't need. Please conserve your strength, Paramedic Taylor. Voral interrupted, his tone simultaneously authoritative and concerned. You are experiencing a severe biological integrity breach that, without immediate intervention, will lead to catastrophic tissue degradation and potential systemic infection. The gurney was already moving, gliding smoothly toward the medical bay with Voral and the students in close formation around it. Sarah tried to sit up, but gentle pressure from LYX kept her in place. Please remain still, the young Xylarian said. Movement accelerates cellular disruption and increases contamination risk. Sarah took a deep breath, trying to remain calm despite her growing frustration. Listen, she said as clearly and firmly as she could. This is a simple laceration. On a human, this is a minor injury. I appreciate your concern, but I just need some antiseptic and a few stitches. Her words seemed to have no effect. The medical bay doors slid open, and the gurney glided to the center of the room where the main examination platform awaited. With practiced efficiency, the students transferred Sarah from the gurney to the platform, which immediately illuminated with soft blue light. Holographic displays sprang to life around her, showing magnified views of her wound from multiple angles. Sarah could see what they were looking at: the clean cut through her epidermis and dermis, the exposed subcutaneous tissue, blood vessels, and the beginning formation of clots along the wound edges. It was, from her perspective, a textbook laceration that was already showing normal signs of the human healing process beginning. But the Xylarians were responding to different visual cues entirely. Observe the microfractures extending from the primary wound site, Vorel was saying, using a thin finger to trace patterns on the holographic display that Sarah could barely perceive. And these dark accumulations indicate biological contaminants already penetrating the deeper tissue layers. Those aren't contaminants, Sarah tried to explain, raising her voice slightly to be heard over the increasingly urgent Xylar medical terminology being exchanged around her. That's just normal blood clotting. It's how human bodies start to heal wounds. Vorel glanced at her, his crystalline features arranged in what she interpreted as an expression of sympathy. I understand your disorientation, Paramedic Taylor. Traumatic injuries often affect cognitive function, even in species with more robust neurological systems than humans. Sarah felt her patience beginning to fray. I am not disoriented. I'm a trained medical professional with 15 years of field experience. What you're seeing as pathological is actually normal human healing. But Vorel had already turned away, directing students to prepare what he called cellular stabilization fields and biomolecular purification emitters. From what Sarah could gather from their rapid technical discussion, they were preparing for a complex surgical procedure that would involve isolating her arm in some kind of energy field, breaking down and removing the blood clots they saw as contaminants, and then using some form of energy-based cellular stimulation to force rapid healing. Her arm was now being secured to the examination platform with gentle but unyielding restraints made of some form of energy field. A larger dome-like field was forming above her entire forearm, creating what she assumed was their version of a sterile environment. This is completely unnecessary, Sarah insisted, attempting once more to reason with them. Human bodies have evolved to handle this type of injury. Our blood clotting mechanism prevents excessive blood loss. Our immune system fights infection, and our cells naturally regenerate to close wounds. Zorn, adjusting controls nearby, responded without looking up. Human biological processes are inefficient and dangerously vulnerable to microbial invasion. Our scans indicate 17 distinct bacterial species already present in the wound site. Of course there are bacteria there, Sarah replied, trying to keep the exasperation from her voice. Human skin is naturally colonized by thousands of bacterial species. Most are either beneficial or harmless. Our immune system is designed to manage them. Vorel approached, holding what appeared to be a slender, luminescent instrument. Paramedic Taylor, I understand your anxiety, but please trust our expertise. By Xylar medical standards, your injury is severe and requires immediate advanced intervention. The procedures we are preparing will prevent the catastrophic tissue degradation that our scans indicate is imminent. Sarah took a deep breath, gathering her thoughts. This wasn't just a misunderstanding. It was a fundamental clash between two entirely different approaches to medicine and biological function. The Xylarians weren't being unreasonable. They were applying their own physiological framework to her human body. Their concern was genuine, but their proposed treatment was entirely inappropriate for human physiology. She needed to take control of the situation. Chief Medical Instructor Vorel, she said, adopting the formal tone she'd observed the Xylarians use. I request immediate access to my personal medical kit. As the only human medical professional aboard, I am uniquely qualified to assess and treat injuries to human physiology. Vorel hesitated, his instrument still hovering above Sarah's arm. Your kit contains physical implements that would introduce additional contamination. Our non-contact methods are far superior for preventing infection. Superior for Xylar physiology, Sarah countered, but potentially harmful for human tissue. Our delegation agreement specified that I would retain authority over human medical issues. I formally invoke that provision now. This legal reminder seemed to give Vorel pause. He straightened, conferring quietly with several students. Sarah could see LYX at the edge of the group, her crystalline features oriented towards Sarah with what seemed like curiosity rather than the alarm displayed by the others. Taking advantage of the momentary distraction, Sarah tested the restraint field holding her injured arm. As she suspected, it was calibrated for the more delicate xylar physiology. With a firm, deliberate movement, she twisted her wrist and pulled, breaking through the energy field with a soft popping sound. The action immediately drew gasps from the students. Zorn nearly dropped the instrument he was holding, his crystalline structure briefly flashing a brighter blue in what Sarah had come to recognize as a sign of distress. "My medical kit," Sarah repeated firmly, sitting up on the examination platform. "Now, please." After another moment of hesitation, Vorel nodded to LYX. "Retrieve paramedic Taylor's emergency medical supplies from her quarters." While they waited, an uncomfortable silence fell over the medical bay. Sarah kept pressure on her wound, noting that the bleeding had already slowed significantly, exactly as expected for a clean laceration of this type. The Xylarians maintained their positions, their scanning devices still, occasionally directed toward her arm, as if they expected it to suddenly deteriorate before their eyes. When LYX returned with the familiar black canvas bag that contained Sarah's personal medical kit, Sarah felt a wave of relief. She'd insisted on bringing this kit aboard despite the Xylarians' assurances that their medical facilities would be more than adequate for any emergency. Old habits died hard, and 15 years as a paramedic had taught her never to be without basic medical supplies. "Thank you," she said, accepting the bag from LYX. "Now, I'm going to demonstrate a standard human emergency field procedure for treating lacerations. I invite you all to observe, as this might be valuable for your understanding of human medical needs." Sarah placed her kit on the examination platform beside her and unzipped it, revealing neatly organized compartments containing various medical supplies. She could feel the students leaning in closer, their curiosity apparently overcoming their alarm. "First," Sarah explained, reaching for an antiseptic wipe, "I'll clean the wound and surrounding area to remove surface contaminants." She tore open the packet and began methodically wiping away the blood and debris from around the laceration. Human skin has a natural bacterial flora, as I mentioned, but we still take precautions against introducing additional pathogens from the environment. The students watched in silence as she discarded the used wipe and extracted a small bottle of sterile saline solution. "Next, I'll irrigate the wound to flush out any remaining debris," she demonstrated, pouring the saline carefully over the laceration, allowing it to wash away any remaining foreign particles. This is simple but effective. Many battlefield medics throughout human history have used similar techniques with whatever clean water source was available. She glanced up to see that several students were now recording the procedure with their devices. Vorel stood slightly apart, his posture rigid, but his attention fixed on Sarah's movements. "Now for wound closure," Sarah continued, removing a small package of butterfly closures from her kit. "For deeper areas of the laceration, I'll first approximate the edges using these adhesive strips." She deftly applied several of the closures to bring together the deepest part of the wound. This reduces tension and creates a foundation for the sutures. She then removed a sealed package containing a curved needle already threaded with absorbable suture material. This is a standard suturing kit. The thread is made of a material that the human body will gradually break down and absorb as the wound heals. A soft murmur ran through the group of students. Sarah couldn't tell if it was dismay or fascination. "You intend to puncture your tissue repeatedly with that metal implement?" Zorn asked, his voice strained. "Yes," Sarah replied matter-of-factly. "It's a proven technique that humans have used for thousands of years, with refinements over time, of course. The sutures will hold the wound closed while the natural healing process occurs beneath." With practiced movements, Sarah began suturing the wound. She narrated each step: how to properly hold the needle driver, the correct angle of entry, the ideal spacing between sutures, and the technique for tying secure knots. Her movements were swift and sure, muscle memory taking over despite the unusual audience. "The goal is to approximate the tissue edges without excess tension," she explained. "Too tight, and it would restrict blood flow and potentially cause tissue necrosis. Too loose, and the wound wouldn't close properly, increasing infection risk and leading to more prominent scarring. As she worked, she could see the students' scanning devices still aimed at her arm, their displays showing real-time data about what was happening beneath the surface of her skin. To her surprise, several of the alarming indicators she had noticed earlier seemed to be changing, the urgent red symbols gradually shifting to yellow and green. Your technique is achieving unexpected stabilization, LYX observed quietly, glancing between Sarah's work and her scanner display. Sarah nodded, continuing her methodical suturing. That's because this is appropriate treatment for human physiology. Your scanners were interpreting normal human wound characteristics through a Zeiler physiological framework. She tied off the final suture and reached for a tube of antibiotic ointment. Now I'll apply a topical antibiotic as an additional precaution against infection. She squeezed a small amount onto her finger and gently spread it over the sutured wound. This helps manage the normal bacterial load while the wound heals. The final step was applying a sterile adhesive dressing over the entire area. And done, Sarah announced, securing the edges of the dressing. A clean, well-approximated laceration like this should heal within 2 weeks with suture. Removal in about 10 days. She looked up to find the entire medical team staring at her in silence. Even Vorel seemed momentarily speechless. LYX was the first to break the silence. Your biological readings, they've stabilized. The indicators of catastrophic degradation have disappeared. Because there was never going to be any catastrophic degradation, Sarah explained gently. What your scanners were interpreting as dangerous instability was actually the normal human inflammatory response, the first stage of our healing process. Vorel stepped forward, his scanner still in hand. But the microbial presence remains substantial. By Zeiler standards, this level of bacterial contamination would cause systemic infection within hours. Sarah nodded. Human immune systems are designed to handle this level of microbial exposure. Our white blood cells and antibodies are already at work fighting any potential infection. She held up her bandaged arm. This dressing isn't airtight or sterile in the way your medical fields are. It's permeable, allowing the wound to breathe while keeping out gross contamination. The medical bay fell silent again as the Xylarians processed this information. Sarah began repacking her medical kit, giving them time to absorb what they had just witnessed. Your approach is remarkably direct, Vorel finally said, his tone difficult for Sarah to interpret. Among Xylarians, such physical interventions would cause more harm than the original injury. Different physiologies require different approaches, Sarah replied. That's why understanding comparative biology is so important for interspecies medical cooperation. LYX stepped closer, her scanner now lowered. Could you explain more about this immune system? Our education contains only basic information about human biology, mostly focused on gross anatomical differences rather than cellular functions. Sarah smiled, seeing a teaching opportunity. I'd be happy to. The human immune system is a complex network of cells, tissues, and organs that work together to defend the body against pathogens. What had begun as a medical emergency gradually transformed into an impromptu lecture on human physiology. The students gathered around, their initial alarm giving way to professional curiosity. Sarah found herself explaining concepts she hadn't consciously thought about since her training days. The difference between innate and adaptive immunity, the role of inflammation in healing, the multi-layered defense mechanisms that allowed humans to survive in environments teeming with microorganisms. Even Vorel eventually joined the discussion, asking increasingly specific questions about how human emergency medicine adapted to different environmental conditions. So in situations without access to medical technology, humans can still effectively treat injuries, he asked, seeming genuinely puzzled by the concept. Absolutely, Sarah replied. Throughout our history, we've developed techniques that work with minimal equipment. That's the foundation of emergency field medicine, making do with what you have. Fascinating, Vorel murmured. He studied his scanner once more, scrolling through the data it had collected during Sarah's self-treatment. Our medical models are clearly inadequate for properly assessing human biological processes. The algorithms interpreted your normal healing response as systemic failure because they're calibrated for xylar physiology. Different evolutionary paths, different solutions to survival, Sarah agreed. Your people evolved with a physiological vulnerability to contamination, so you developed advanced technological barriers against it. Humans evolved robust, internal defense mechanisms instead. Zorn, who had been silently observing until now, finally spoke up. Protocol dictates that medical models must be updated when new data contradicts existing parameters. Should we develop human-specific assessment algorithms? Sarah couldn't help but smile at the students' reluctant acknowledgement that their procedures might need revision. That would be an excellent idea. And perhaps I could learn more about your non-invasive healing techniques as well. There must be applications where they would be superior to our methods. By the time the impromptu teaching session concluded, the mood in the medical bay had transformed completely. What had begun as a crisis had evolved into a valuable exchange of knowledge. Even Vorel seemed more relaxed, his initial rigidity softened by scientific curiosity. Rest is recommended for optimal healing, he advised as Sarah prepared to leave. Perhaps we could continue this discussion tomorrow, when you have recovered. Sarah glanced at her bandaged arm. Actually, this won't significantly impair my activities. Human bodies are quite adaptable to functioning while healing. Seeing his concern, she added, but I agree that continuing our discussion tomorrow would be beneficial. Perhaps we could formalize it into a proper comparative medicine seminar. The next few days passed quickly, with Sarah's arm healing exactly as expected, a fact that the Xylar medical team monitored with continuing amazement. True to her word, Sarah organized a series of practical workshops on human emergency field medicine. In a large training room adjacent to the medical bay, she set up stations with anatomical models and practice dummies borrowed from the ship's emergency response training equipment. The models weren't perfect analogs for human physiology, but they served well enough for demonstration purposes. Today we'll cover basic field techniques that require minimal equipment, Sarah announced to the assembled group, which now included not only Vorel and his students, but several other Xylar medical personnel who had heard about the incident. These are approaches developed for situations where advanced technology isn't available or has failed. She moved to the first station, where she had arranged simple materials, rigid sticks of various lengths, fabric strips, and bandages. We'll start with improvised splinting for fractures. When a human bone breaks, immobilizing it properly can prevent further damage and reduce pain while the body begins the healing process. The Xylarians observed with fascination as Sarah demonstrated how to identify a fracture through manual assessment, then how to create an effective splint using materials that might be found in nearly any environment. Their slender fingers were initially clumsy with the unfamiliar physical manipulations, but they learned quickly. Remember, Sarah emphasized as they practiced, these techniques aren't meant to replace proper treatment. They're designed to stabilize a patient until more comprehensive care is available. Sometimes it might be minutes, sometimes days. At the next station, she demonstrated burn treatment using simple sterile dressings. Unlike cuts, burns destroy the protective barrier of the skin and create a perfect environment for infection. Clean, moist dressings help protect the area while the body rebuilds the damaged tissue. LYX, who had become Sarah's most enthusiastic student, raised a question. But without cellular regeneration fields, how does the new skin form correctly? The human body has its own regeneration programming, Sarah explained. Specialized cells called fibroblasts move into the wound area and begin producing collagen, which forms the foundation for new skin. It's slower than your methods, but remarkably effective. The most dramatic demonstration came when Sarah taught them about controlling hemorrhage. Using a specially designed training dummy with simulated blood vessels, she showed how direct pressure, elevation, and knowledge of pressure points could control even severe bleeding. When all else fails, she explained, demonstrating the proper positioning of a tourniquet. This method can be life-saving, though it comes with significant risks if left in place too long. It's considered a last resort when direct pressure hasn't controlled the bleeding. Vorel, who had been quietly observing the practical exercises, finally stepped forward. These methods are impressively effective given their simplicity. Yet they all involve direct physical contact with potentially contaminated tissues and fluids. Sarah nodded. Human medical practitioners have developed protocols to minimize risk: gloves, masks, protective eyewear. But in true emergencies, the immediate threat to life often outweighs the risk of contamination. Our immune systems provide significant protection, a fundamentally different approach, Voral mused. Our medical philosophy has always prioritized absolute sterility and non-invasive intervention. Yet I cannot deny the effectiveness of your methods in your physiology context. The final station of the day focused on neurological assessment without scanning technology. Sarah demonstrated how to check pupillary response, test for orientation with simple questions, and assess motor function through basic commands. The human brain can suffer injury without visible external damage, she explained. These assessments help determine if there's swelling or damage affecting brain function. Changes in pupil size or responsiveness often indicate increasing pressure inside the skull, a potentially life-threatening condition. By the end of the session, the Xyler medical personnel were practicing on each other with growing confidence, their initial revulsion at the primitive physical contact methods giving way to professional interest in mastering new techniques. Sarah watched as LYX correctly demonstrated a pupillary response check on Zorn, accurately describing what normal and abnormal findings would indicate. Even a formerly skeptical Zorn was engaged now, carefully following the protocols Sarah had taught them. As a training session concluded, Voral approached Sarah with what she had come to recognize as his version of thoughtful consideration. Paramedic Taylor, he began formally, these past days have been most educational. I believe there is significant value in incorporating aspects of your emergency field techniques into our standard curriculum, particularly for medical personnel who may encounter humans in emergency situations. Sarah couldn't hide her surprise. That's wonderful to hear, Chief Medical Instructor. I would be happy to help develop appropriate training materials. Voral's crystalline features arranged themselves into what Sarah had learned was an expression of certainty. Indeed. Furthermore, I have submitted a formal proposal to the Xyler Medical Academy to establish a new required course module on comparative biological resilience and field efficacy. With your permission, I would like to list you as a special advisor to the Curriculum Development Committee. Sarah felt a genuine smile spread across her face. I would be honored, Voral. In the days that followed, Sarah's wound continued to heal cleanly. The Xyler students documented every stage of the process with their scanning devices, creating what would become the foundation for the first comprehensive medical database on human wound healing accessible to Xyler practitioners. For the final session of her impromptu training course, Sarah stood at the front of the training room, watching as the students practiced bandaging techniques on each other. They had adapted the procedures to account for their more fragile physiology, using appropriate protective barriers where necessary, but the fundamental approaches remained those Sarah had taught them. Voral joined her, observing the students' progress. They have adapted remarkably well to these hands-on methods, he noted, particularly LYX, who has shown exceptional aptitude. Indeed, LYX was demonstrating perfect technique as she applied a pressure bandage to another student's arm, her movements confident and precise. She has natural talent, Sarah agreed. The best medical practitioners combine technical skill with intuitive understanding, regardless of the technology level they're working with. Voral's crystalline structure shifted slightly in what Sarah had come to recognize as their equivalent of a contemplative nod. When you first arrived, I confess I questioned the value of including primitive human medical approaches in our exchange program. I believed our advanced techniques had rendered such methods obsolete. He gestured toward the students. Yet now I see that technological advancement and fundamental skill are not mutually exclusive paths. There is wisdom in understanding both approaches, knowing when to rely on advanced technology and when simpler methods might be more appropriate or the only option available. Sarah smiled, thinking of all the times in her career when basic training and improvisation had saved lives when more advanced options weren't available. The best tools are the ones you have with you when you need them, whether that's a regenerative energy field or a simple pressure bandage. As the session concluded, Sarah watched the Xyler medical students gathering their materials, discussing the techniques they'd learned with animated gestures. What had begun as a misunderstanding about a simple cut had transformed into something far more valuable, a bridge between two vastly different approaches to medicine, each with lessons to teach the other. She glanced down at her healing arm, the neat line of sutures visible beneath the transparent dressing she'd applied that morning. Sometimes the most effective teaching happened not through formal instruction, but through lived example. Her injury had provided something no planned demonstration could have, an authentic opportunity to demonstrate the resilience of human physiology and the effectiveness of field medicine techniques. As Sarah prepared to leave the training room, LYX approached her, holding what appeared to be a small, crystalline device. Paramedic Taylor, the young Xylerian, said, "I have been researching human medical history. Your people have accomplished remarkable advances despite your biological limitations. I would like to learn more about how human medicine developed these adaptive approaches." Sarah smiled, recognizing in LYX's curiosity the same drive that had pushed her to volunteer for this exchange program in the first place. The desire to learn across boundaries, to understand different approaches to solving universal challenges. "I'd be happy to tell you more," she replied. "And I'd like to learn more about your regenerative techniques as well. Perhaps there are ways we could combine approaches for more effective treatment options for multiple species." As they walked together toward the ship's communal area, Sarah reflected on how differently her cultural exchange had unfolded than she'd expected. She had come aboard the Stellaris planning to learn advanced alien medical technology. Instead, she had ended up teaching the fundamentals of human field medicine. But isn't that what true exchange was about? Not just learning new techniques, but also sharing your own expertise, finding the value in different approaches, and building bridges between diverse knowledge systems. In medicine, as in diplomacy, understanding differences was often the first step toward meaningful cooperation. Her arm would heal with minimal scarring, thanks to her prompt and appropriate treatment. But the understanding that had developed between human and Xyler medical approaches, that was the more significant healing that had occurred, one that would benefit both species for years to come.